back to the Geary Theory. I'm your host, Lauren Geary, and today I'm talking to Dr. James Thorp. Now, Dr. Thorp wrote this book. It's amazing. I highly recommend, called Sacrifice: How the Deadliest Vaccine in History Targeted the Most Vulnerable. And his co-author was Celia Farber. This is an amazing book. I highly recommend. I don't like medical books. This one I couldn't put down. Now, what he talked about in this book is how the COVID vaccine essentially targeted the most vulnerable, meaning babies in the womb. Because Dr. Thorpe is an OB-GYN specializing in high-risk pregnancies, and he saw what was happening when the rollout happened and all the stillbirths and miscarriages that just followed suit. And that's why he calls it a Holocaust, because the numbers are drastic. He talks about a whistleblower nurse in the book, actually talks about how in her hospital, she was a labor and delivery nurse, and she saw an average of 4 stillbirths a year. The rollout happens, that number changed, and it's documented through an email, to 22 a month. So it went from 4 a year to 22 a month. Some of these parents showing up thinking they were there to be induced to have their baby, and being told that from the time they had the ultrasound yesterday to that morning, their baby had passed away. When they look at the chart, the mother is fully vaccinated. Now, you guys can think this is just crazy, but it literally changed from 4 a year to 22 a month after the rollout. You would hope Pfizer didn't know about this and it was just a completely big accident, but they actually knew. It's documented in this book. We get into that too. And think about it this way. When I'm pregnant, they tell me I can't eat shellfish. I can't even have sandwich meat. So sandwich meat is so deadly. I should actually, if I'm going to eat it, I need to make sure I cook it on the grill. Make sure I kill off all the bacteria. But then we're going to inject women with high levels of mercury and all these other chemicals, not having tested it. And when we did test it, actually, we're not going to tell you, but we tested it and found out there's some fertility issues and miscarriages, and we know about this, and we're just going to overlook it because everything is safe and effective. So we're taking women that are carrying the most vulnerable, the most precious life in the womb, and we're just massively injecting them and hoping for the best. That's so wrong. And I also got into it with him. I said, I'm noticing a massive amount of infertility. I've been noticing this for quite a while, but I don't know if it's just me, but I noticed it drastically increase in the last 4 years. And I'm starting to put 2 and 2 together. And I was like, do you know if there's an infertility relationship between the COVID vaccine and what we're seeing today? And he's like, absolutely. And so I just want to say, if you're listening to this and you're struggling with infertility, I'm not saying it's 100% because of the vaccine. I know there's so many reasons someone can struggle with infertility, but I'm saying we talk about, you can get a simple test to check your spike protein levels. If they're high, you can do things to adjust that to maybe resolve your infertility that was caused by the vaccine. So again, I'm not saying everybody with infertility is because of the vaccine, but there are a lot of people in this world that are struggling with infertility all of a sudden, and there's evidence to show that there's a relationship between this mass spike of infertility and the vaccine. So maybe we should take time to look at that, because if there's something we can do to adjust it, let's do that. Oh, sorry. And before we get into it, I just want to say the mic for some reason malfunctioned while we were recording this. So Dr. Thorpe sounds great, which is perfect because he's really all you need to listen to. My mic, it was picking up my iPad's mic for some reason, and it didn't do my fancy dancy mic. So I just want to apologize in advance for my audio being bad, but luckily Dr. Thorpe's is perfect, which is all we're really here for. All right, let's get into it. Dr. Thorpe, thank you so much for having coming on today. I really appreciate it. I have your book right here, Sacrifice, and I've been reading through it. It's been the first chapter. I was telling on my my Instagram followers, I was like, usually medical books, I have a hard time reading, but you and your co-author wrote this so well. I was hooked. I was really hooked. You have such engaging stories, and my heart broke. So I actually had my firstborn in 2020, And I wasn't heavily pressured, but I was definitely offered on multiple occasions to get the vaccine. I'm glad to say I didn't. At the time, I didn't really know how great of a decision that was. I just was trusting my gut. And reading your book here, especially being pregnant, and then I had my second in 2022, so I was still being pressured to get the shot. I was like, man, I'm so glad I trust my gut. So I'm excited to get into this. Could you start by just giving an introduction of yourself and a little bit of your medical background for us?
Sure. First of all, Lauren, I just want to thank you for having me on your illustrious platform. And I also want to congratulate you because you're one of the elite few that were not forced into taking the vaccine by fear, by intimidation, and by bought off healthcare professionals that were pushing it, I believe, unethically without informed consent. So kudos to following your gut. You are a brilliant young lady and an incredible journalist, and really, most importantly, an incredible mother.
Appreciate it.
So, yeah, my name is Jim Thorp, and I'm an MD, and just in ways of background, I've been in practice and I'm actively practicing right now, and for 46 years. So I'm really blessed. I'm a disabled veteran. I served in the United States Air Force as a HPSP commitment to the Air Force and putting me through medical school. So I graduated from medical school, I think one of the largest, one of the best medical schools in the country, and that's Wayne State University School of Medicine in Detroit. We saw everything. I was very honored and privileged to, I think, by divine circumstances, I wasn't forced to go into a military residency, which were very subpar. And God just orchestrated things to get me into the most prominent and best perinatal capital of the world at the time, which was University of Colorado in Denver. And that's where I went. And after that, I graduated from medical school in 1979. I went out to Colorado, did my 4-year residency, and completed that, and then went into active duty Air Force as an OB-GYN physician, a generalist. And that was in the mid 80s, serving my country in the Cold War. And incredible experience. I was on active duty for 3 years, inactive reserve status list for another 10 or 15 years through Gulf War I. And my unit didn't get deployed over there. Unfortunately, I was excited about going over there, but never got called. After my active duty in 86, I went on to do a fellowship at the University of Texas, Houston Medical Center, and did that and achieved my board certification, not only in obstetrics and gynecology, but in the subspecialty of maternal-fetal medicine, and that is high-risk obstetrics. Hopefully you didn't have to see one of us during your pregnancies.
No, unfortunately not to.
And really,
one.
Good for you. So that's really it. I've always been extremely focused on clinical practice. I actually refused to go in the fast track academic, which I was pressured highly to get into. The reason why I didn't want to get into that is because I have a keen interest in research, and I've extensively published in peer-reviewed medical journals throughout my career, well over 200, well over, I think over 250 peer-reviewed manuscripts and abstracts and presentations around the world. So, I wanted to do my own research and fund my own research and answer my own questions and design my own clinical studies. And that's what I did. And I did it very successful outside of a fast-track academic program that would have been captured, and I would have received government funding, and I would have been told what to do. I didn't want that.
Yeah. What a great thing to aspire to, just having that freedom to do it the way you want to do it. And that takes a lot of courage, because I'm sure it was a lot easier to go about just getting somebody to fund you and do it their way.
Yeah, you're right. And in the book that my co-author Celia Farber and I published that you mentioned, Sacrifice, How the Deadliest Vaccine in History Targeted the Most Vulnerable, I talk a lot about how I was influenced by some of my heroes very early in life, and that set me on this trajectory. And of course, one of those would be my mother, who was a labor and delivery nurse. And I was focused a lot on just her experiences. And then I read a lot about Dr. Ignaz Philipp Semmelweis in the book of 150 years ago at the Vienna Lying-in Hospital. And you may not have gotten to that part in the book, but he was one of my heroes because he was an OB-GYN doctor, and he really, early in life, I read his story, I watched some of the documentaries on him, and literally he was the father of clinical research, maybe, and maybe he was also the father of infectious disease, because he, at his time, at the Vienna Lying-in Hospital, Dr. Semmelweis had, like, in some months, 20, 30, 40, 50% of normal, healthy women would die after birth from what they termed puerperal fever, which was what we now know as severe postpartum uterine infection called endometritis, probably from group A beta hemolytic strep. They had no idea of bacteria. They had no idea. But Ignaz Philipp Semmelweis, he was the one that determined the cause.
Wow.
He determined that it was the doctors on the doctor's side of the hospital ward. They would go from the autopsy room up to the delivery room, infecting their patients and in essence killing them. Whereas the nurse midwives on the other side of the hospital side, mirror image ward, had a minuscule percentage compared to the doctor's side. And Ignaz figured it out that there was something going on, transmission from the autopsy room to the delivery room that was causing the infections. They knew nothing of bacteria.
Yeah.
And so he was the first one that proved. He figured, okay, let's try to wash our hands with a lime lye solution, which is kind of like soap. Wash the hands before you go back upstairs. Saw and published a huge decrement, yet the establishment mocked and ridiculed him so badly they put him in an insane asylum. How dare you refute the knowledge of the day? So he died as a pauper
Oh my God.
in jail or a psychiatric institution. So
So this has been going on for a long time. It's
Yeah.
not just new. We're silencing people in the medical field.
And I read the book about him, and I would, I talk about this in my book, but as a young man, in high school, I read the book Morton Thompson's, The Cry and the Covenant, I believe was the name of his book, and it was all about Ignaz. And that he set my path. He was my model. He was my hero. I almost feel like, in a way, he's been my mentor, even though I've never met him, because he asked simple questions and simple research designed by himself to answer important questions. And that's what I've tried to do. And little did I know when I was 20 years old, or 18 years old, or 16 years old, when I read that book, little did I know that God put me on this trajectory unbeknownst to me.
Yeah.
I would have never believed that God would have put me in a situation, 50 years later, where I was in an obstetrical massacre that made Ignaz Philipp Semmelweis's horrible situation in Vienna in the mid-1800s look like a walk in the park. And little did I know. But it's almost like God created me to be here in this time.
Did. Yeah, I do. I truly believe that we're not just plopped into a random time zone or timeline in history. I think God intentionally, we were born in this time period for this reason, just like people of the past were born for the reasons we can see in their past life. It's amazing that you can see that too. And especially, I love the connection of not just the doctor and him speaking out, and I think it's sad they put him in a sane asylum over that. So they some of those washing hands was controversial. But it's the back to, your connection with labor and delivery and his. It truly, I can see why you see him as such a mentor. It's amazing.
It's so amazing. And it was my wife Maggie and I. My wife Maggie is an attorney, and I don't know this, that you know this, but she is part of my research team, as are many others that I've published with and mentored young ladies in this area. And so it's been, Maggie and I have published extensively on a separate platform, America Out Loud platform, probably 20 or so publications documenting the horrible corruption of our government agencies, our medical organizations, supposedly NGOs, non-governmental organizations, that have been captured and that have been pushing the COVID-19 vaccine in pregnant women to this very day. And it's an abomination, because I've published extensively on it from the governmental data, and it's a horrible thing. It's important for your viewers, your audience, to realize that first of all, what I tell my patients right now is, don't trust Dr. Jim Thorp. Don't trust any physician. Don't trust any nurse. Don't trust any hospital, any agency, any body that makes recommendations. Don't trust them. Empower yourself. You are your own best health advocate. And you young ladies that are pregnant, you are your own best advocate for your children's health care. You are.
It's so true. And I didn't realize, I was a person that trusted mostly doctors until the COVID thing, and then I kind of got more skeptical. But I trusted, other than COVID, I trusted doctors for the most part. And then I had my son, And I was like, oh, I don't trust these people at all. Like, I have to do my own research. And you even know, like, when I went through even just the first birth, there's so many people, like, between the nurse and this doctor, so many different opinions on what is right and what's the wrong thing to do. And especially when it comes to birth, there's so many nuances. Everyone has their own birth plan and everything. I learned through that experience, as I think a lot of people do, especially actually having the child. You have to be your own advocate, because at the end of the day, you're the one that faces the consequences for the decisions that they push on you. So,
and
100%.
Those who are pushing the vaccine, they're not going to be there for you when you or your baby get injured. They're going to throw you under the bus and gaslight you that they've done for 5 years now. Actually, they've done for 50 years in the vaccine industry. But Lauren, I want to just go over specifically.
Yeah.
When you go in to see your OB, I'll make it personal with you.
Yeah, please.
Everybody watching, okay, this, and I've testified to this in the Senate and in many other major interviews and many other bodies of government in the world, many other large testimonies and lawsuits as an expert witness. I've testified to this. When you, Lauren, went in to see your OB-GYN doctor, it's the most sacred relationship, I believe, in all of medicine, is a young woman with her baby in the womb going to her OB-GYN doctor. I believe that's the most important, the closest physician-patient relationship that a woman has between her with a baby in her womb and her obstetrician. So I'm here to tell you in no uncertain terms that whichever obstetrician you saw and the rest of your audience, you weren't speaking to your obstetrician. You were speaking to a puppet of the HHS, CDC, and FDA. And why do I say that? I say that I don't care how sincere she or he was, how closely and you believed them and trusted them. Here's the fact of the matter. On September 27th, 2021, they colluded, the American Board of Obstetrics and Gynecology, the American College of Obstetricians and Gynecologists, and the Society for Maternal-Fetal Medicine, the three governing bodies really, not just of the United States of America and Canada, but really to the whole world. They set precedent. So as America goes, and those three governing bodies, so goes the rest of the world. So what did they do? They colluded, not just the three organizations, but they also colluded with the Federation of State Medical Boards and the American Board of Medical Specialties. They colluded in a letter sent to 62,000 OB-GYN doctors, which is the famous letter, and you can get it today. Look at it on my website or find it yourself. And they basically said, if you do not follow our recommendations for pushing the COVID-19 vaccine in pregnant women and all your employees and all your patients, and you spread any misinformation, we will destroy your career. We'll take away all of your medical licenses and all of your board certifications that the doctors have worked for their life. That's what they did, and that's what that letter is still up on the website and for anybody to see. So
you're saying every OB-GYN in the country received this?
every 62,000 OB-GYN doctors in the United States of America and in Canada and in a few countries in South America. The American College of Obstetricians and Gynecologists, they bribed, they threatened, they took money under the table from the government. And by the way, attorney Maggie Thorp, JD, and myself have proven this with a Freedom of Information Act request, and it's published. It's in many publications, and so think about this, Lauren. You weren't talking to your doctor.
No.
If she told you the truth, she would lose her job, just like I did. And let me, to make a point, let me pull this up because this is such an important point. First of all, you're too young to remember the thalidomide and the diethylstilbestrol disasters, or do you remember them?
No, so I'll tell you, I'm 34. I have a baby face, I've been told, but no, I don't remember that.
So they're in the book, but thalidomide was pushed by the pharmaceutical industry in the 60s, was pushed on pregnant women for nausea and vomiting of pregnancy. It turned into a disaster. It caused multiple deaths and malformations of babies globally.
Jeez.
The babies with the missing arm, the missing legs.
Oh, yes, I remember hearing about this now that you mention it.
Phocomelia. And then there was another drug that was even worse called diethylstilbestrol that was used, again, a corrupt pharmaceutical company from Germany. Diethylstilbestrol, it's called acronym DES, diethylstilbestrol, caused multi-generational damages, brain damage, physical damages to baby girls and baby boys.
Wow.
And was marketed as to prevent miscarriage when it caused, and it's not only the DES daughters and sons, now it's epigenetics, DES daughters, granddaughters and grandsons, and great granddaughters and great grandsons. That's what DES did.
Wow.
So my generation, we learned that. I took care of those patients. So this is why you never use a novel substance in pregnancy. That's the golden rule of pregnancy. And Lauren, your gut, I would term it the Holy Spirit.
Yeah.
Guided you. And there's 4 pillars of medical ethics. And I'll just review them really briefly. The first one is patient autonomy. The second one is patient beneficence. The third one is non-malfeasance. That is, first, do no harm.
Right.
The Latin legal term of that is primum non nocere, first, do no harm. The fourth is justice. Your obstetrician and every obstetrician practicing is breaking all 4 rules and laws of medical ethics. So if they were honest, I want to show you the legally mandated package insert from the COVID-19 vaccine, which is legally mandated, and exactly what comes to your pharmacy and to the pharmacist or anybody injecting this medication.
Yeah.
This is kind of like one of these folded pieces of paper that goes into every single vaccine vial.
Yeah.
Here, let me show you exactly. Usually this is filled with fine print on both sides.
Yeah.
It's like a Japanese origami, right?
That's terrible.
It's a huge document. I'm going to back up a little bit. It's huge.
What a waste of paper.
Okay, look at what it says. It's the same thing on both sides. And if you can read what it says up there, I think.
Intentionally blank.
You see that?
Yep.
Okay.
Intentionally blank.
So how can, when your obstetricians and gynecologists or any other doctors pushing this vaccine, how can they give true, honest, informed consent without reviewing this
Right.
and without reviewing also the legally mandated Pfizer 5.3.6 post-marketing adverse complications, which should have been made known to everybody. Those were available. This was completed. This was just the first 10 weeks of the rollout from mid-December 2020 to February 28, 2021. 10 weeks. In 10 weeks, just Pfizer, not including AstraZeneca, Moderna, and just Pfizer, 42,086 casualties, including 1,225 dead. And most of those deaths occurred immediately after or within the first few days.
So say that again. There was 42,000.
42,086 casualties.
Okay. And then when you say casualties, are you talking just babies in the womb, or are you talking?
No, this is all comers. All comers.
Okay.
42,086 casualties.
Wow.
With 1,225 dead in just 10 weeks of the first 10 weeks of Pfizer rollout. And they tried to hide that for 75 years. Did your obstetrician tell you that? No.
I think I just honestly shut them down so quick. But
No.
no, of course they wouldn't if I had asked. I've asked before about other things, even though I knew I was going to say no. I just wanted to see what they'd say. Yeah, they don't give me anything. And in fact, when I took my kids in, I wasn't, at the time we've changed our tune, but at first I was like, well, we're just not going to do the COVID vaccine. We'll do some of the childhood vaccines. I've now changed my tune on that. They give me this little like 8x10 thing that at the time I would have assumed was the insert if I had heard the term. It was just mild. Everything was mild compared to what the insert would actually say. And I just feel like if you were to ask that, you're going to get a red little bump on your arm, maybe stiffness. That's the side effects that I was told for my childhood vaccine. So I can imagine that was what I was going to be told for COVID.
Yeah, it's, we review, after the American Board of Obstetrics and Gynecology colluding with the American College of Obstetricians and Gynecologists, the Society for Maternal-Fetal Medicine, the Federation of State Medical Boards, the American Board of Medical Specialties, after they colluded, received millions and millions of dollars under the table to, this is fascism. This is, by the way, illegal, because it's illegal for a government organization to capture a non-governmental organization and use them as their puppets. Highly illegal.
Yeah.
It's unconstitutional. It's awful. And so this is what we were subjected to. So after that letter, I was a board examiner myself for the American Board of OB-GYN back in the late 90s, early turn of the century, right? And I've been lauded with awards and praises from all three of my organizations. I was on the International Board of Directors for 3 years for the Society for Maternal-Fetal Medicine, high-risk OB-GYN doctors, right? So they knew my track record, they knew my publications, they honored me my whole career. And when I called up and tried to speak with then director of the American Board of Obstetrics and Gynecology, Dr. George Wendell, who is my contemporary, he threatened me. He wouldn't talk to me on the phone and told me to shut up or I'd lose my medical licenses and my board certifications. Dr. George Wendell of the American Board of Obstetrics and Gynecology. I said, no, George, this is not science, this is fascism. So then 3 months later, I published a massive expose This was published on January 12th, 2022, in response to the threat to 62,000 OB-GYN doctors in the United States of America. And I laid out all the evidence, all the government data from just the first 8 months showing a massive, horrible effect on pregnancy and pregnancy losses and fetal death and miscarriages. I put it in there, and I also included, this was a 98-page letter because it included references for 1,019 peer-reviewed publications that documented death or injury after the COVID-19 vaccines, and that was only in 12 months. So,
So they knew for sure.
I made my point.
Yeah.
I published it as an open letter. It went viral all over the world, and anybody that wants to read that,
I'll put a link.
many.
At the bottom.
It's, if you go to drjathorp.com, as in Dr. J, as in James, A, as in Alan, my middle initial, Thorp, Thorp, no E.com, drjathorp.com. You can see the letter that they sent. You can see my response. It was, many have termed it an opus magnus. And after that was published and I sent it to all the officers of the organizations, crickets. And I still have my board certification and all my licenses.
Good.
And I'm still practicing. So they knew I was right. They knew they were wrong. I've accused them of mass genocide and killing through pushing this vaccine to the most vulnerable, pregnant women, preborns, and newborns. That's a pretty libelous statement. I haven't been sued.
Yeah. If they had grounds to sue you as if you were wrong,
I haven't
see
been
some
sued.
lawsuit.
I haven't been sued for defamation, and they got deep pockets, and there's a reason why I haven't been sued.
Yeah.
They know I'm right. They know they're wrong, number one. And they know if they sue me, that there's going to be multiple deep pocket organizations that will be happy to take them on. And in lawsuits, there is a legal process whereby we can obtain all the relevant documents
Yeah. I
that
don't want that out.
that's called discovery,
Right.
and they will be screwed.
Yeah. Yeah. They don't want to open up that can of worms because I'm sure there's a lot more that is not even something that we know about. And then tell me, so let's go into it. What was the exact, break it down for us. What was the effects of the COVID vaccine in pregnant women?
Okay, so let's start with non-pregnant women of reproductive age first.
Okay.
Massive complications, including over 1,200 documented complications and adverse effects that were quoted on that Pfizer 5.3.6 legally mandated post-marketing data. Over, almost, I think, 1,250 or 1,300 complications that they documented. So every single one of those, including death, most concerning severe menstrual abnormalities, which we published on extensively. My Cycle Story was the first group to really bring that out.
Yeah.
Infertility.
Yeah.
It causes severe infertility. It causes early onset menopause. Why? Because every woman that got the real one, it destroys their remaining egg cells. Remember, the egg cells are ovum. Female fetuses at birth, newborns, only have 1 million. Very unlike the men that, have 250 million with every ejaculation, right? It's very, very different. A female newborn, a baby girl, even in the womb, only has 1 million for their entire life. And there's programmed cell death of those called apoptosis. Well, what did the vaccine do? The vaccine is concentrated in the preborn's girl's ovaries and in every woman, child, daughter of our Most High God that receives that. The vaccine and the lipid nanoparticles were concentrated hundreds-fold in the ovaries and caused a destruction of the remaining ova. That's why I'm seeing women in their 20s in premature menopause. And this is nobody's studying it in the United States of America because it's so captured. Nobody is studying it. And that's exactly the ontogenesis of my group, our group, called Advanced Biological Research Group, abrg.org. We're a 501c3. There are 6 founding members, including myself. And we are set to go, and we're rolling out 2 studies to answer these issues for women of reproductive age. And unfortunately, all the funding for this heretofore has been government or from pharmaceutical companies. So we put thousands of dollars of our own monies and thousands of hours of our own time into this. And we're about ready to start the study, and by God's grace, we will get funded by donations. Yeah. But nobody else it's interestingly, where has some of the study data come from? From countries that you wouldn't ever believe. Czechoslovakia released all of their data, transparent medical data that is like Medicare, Medicaid, medical data directly from the charts. They released it all, de-identified, and the timing of the vaccines. And what did we find? Horrible disasters of the vaccine, COVID-19 vaccine in Czechoslovakia, including now 30% reduction in birth rates and fertility. Just recently.
Yeah, sorry to interrupt. I know we talked about this prior, but I'm just seeing so many women having infertility, and I know it's been a problem for a while, but I kind of like my perspective without looking at any data. Once in a while I hear somebody struggling, but it seems like in the last couple of years, all of a sudden, everybody I know is struggling to have kids. And I know several people that had their first child fine, and now all of a sudden they can't have a second child. And I know that not everyone we can say is because of the COVID vaccine, but it does seem very odd to me that all of a sudden, everywhere I look on social media, people are going through IVF treatments and struggling with infertility. I keep hearing people being told that they're just too thin. I'm like, that doesn't make sense to me. I mean, maybe it does for a doctor, but it just seems like they don't really know. So they just say, oh, you need to gain weight. So I don't know. I guess that this is kind of making sense to me that there could be something with the COVID vaccine causing this massive spike of infertility we see in our population.
You're so right. The other really important study is Karaman, Karaman, and colleagues that documented in an animal model, I believe in Wistar rats, documented that a human adjusted weight dose of the vaccine given to the Wistar rats destroys the 60% of the ovum in those Wistar rats, ovaries, female rats, 60%. And of all places, I talked about Manisian colleagues from Czechoslovakia, right? And a former communist bloc nation, right? I mean, they're the only country in the world that has released all their data and made it available to the public legally.
Yeah.
Now, also New Zealand did that, but it was done by a whistleblower, and that whistleblower is in jail. So why is all this research being done outside the United States of America? It's because of the medical industrial complex, which is an extension of I dare say, the deep state.
Yeah.
But it's the globalists, it's the
Right.
it's the puppeteers in the government. The entire HHS was basically hijacked by the vaccine manufacturers. Listen, the vaccine manufacturers, the pharmaceutical companies own our government now.
Yeah.
About 50% of their income of the HHS, CDC, is from pharmaceutical companies. And the same thing with all of the medical journal publications, the same thing with all the supposedly independent medical organizations, like I mentioned, the American College of Obstetricians and Gynecologists, the American Board of OB-GYN, the Society for Maternal-Fetal Medicine, and hundreds more, American Academy of Pediatrics, the AMA, all of them are owned by the government pharmaceutical complex,
Yeah.
including the major universities. They're all captured, and Maggie and I have published this in multiple publications, probably 20 of them, on the America Out Loud platform, highly cited medical legal briefs with very well documentation and citations on them, exactly how this was done. And it's scary.
Yeah. It is. And we're so relying on the medical system more than ever. I mean, I like to watch old movies, and watching Little House on the Prairie, I'm like, that doctor came around once in a while. It wasn't this, need for everybody has to have insurance, and because you could come down with a $100,000 plus bill at the drop of a hat. And I think that's designed. We're just so relying on working for a company so you can get health insurance. You're afraid to step out and do your own independent thing, because then you lose your health insurance. And the way I think it's just kind of a part of that whole system of, let's just keep everybody working class, and let's keep everyone enslaved to this idea that they need medical insurance, because then look what happens. I mean, you get a little cut in your arm, and now you're with a $20,000 bill. It's just insane the way that our medical system has completely taken over. So what you're saying is, you're saying the first thing that the COVID shot is causing is infertility. What other things did it start causing?
Well, every other death imaginable and chronic illness in everybody, all women non-pregnant. But then during pregnancy, it's especially disastrous. It's associated with a significant increase in miscarriage, in what we call teratogenesis, or as the organs are developing in the embryo, disruption with major embryonic fetal malformations at birth, a substantial increase in cervical insufficiency, which cervical insufficiency, for those of you watching, the cervix is like your fist, right? And it's very tight and closed, and you should have 4 knuckles of length between your internal opening that keeps the baby inside the womb and your birth canal or your vagina. This should be tightly closed. It's the exact same size, women, of your fist, except it's obviously in your pelvis. Well, what happens is that it's now known that the mRNA, not only does it cross right through the placenta before and after pregnancy, but it becomes bioactive, replicating spike protein, which is not only are the lipid nanoparticles the most inflammatory substance ever known to man, the spike protein likewise extremely inflammatory. So the mRNA makes all the fetal tissues and maternal tissues turn into spike protein factories. And one of the areas that it does it is the lining of the uterus, which is immediately adjacent to the pregnancy sac. The pregnancy sac is composed of two layers, amnion and chorion, and they're unique membranes, unlike anywhere else in the body. And so that when that maternal layer, the mom's layer of the inside lining of the uterus called the decidua, is programmed, and that's where the mRNA went, and it's producing massive amounts of spike protein, which then causes inflammation in the membranes. It liberates many inflammatory mediators, which I won't mention, probably too detailed. It causes opening up of the cervix so that instead of the cervix being closed tight, it opens up. Then the membrane comes down through, and then the membrane becomes infected. You break your bag of water, you have preterm labor, you have a pregnancy loss, you have a placental separation, and that's why we're seeing so many losses with premature labor, premature ruptured membranes. It's from cervical insufficiency. Now, if the cervical insufficiency doesn't occur, then what happens is there's severe placental dysfunction, so your baby inside the womb doesn't get fed normally with nutrients, with oxygen. There's limited gas exchange. Remember, the fetus, while it does, the preborn, it does make breathing movements.
Yeah.
The lungs aren't oxygenating the baby. It's the placenta. Mom is oxygenating the baby through the placenta. So when the placenta becomes diseased and calcified and infarctions or dead tissue in it, then the babies won't thrive in the womb. They'll become growth restriction due to lack of oxygen, buildup of toxins, lack of healthy nutrients, and that's called fetal growth restriction. Or fetal death occurs, blood clots occur, massive bleeding occurs, many other diseases, cardiac disease in pregnant women, seizure, new onset seizure disorders, POTS syndrome that you've probably heard about, and all of the autoimmune diseases come out in pregnancy. And then there's a substantial increase in newborns that die, even in the later gestational ages, a massive increase in newborns that have to go to the neonatal intensive care unit, and every complication, severe preeclampsia. I've never seen anything like it in my life at early gestational ages. And fetal heart blockage, arrhythmias, blood clots in the placenta, everything you could imagine.
Yeah, it seems like it just causes all the kind of issues you could want to avoid in pregnancy. It seems like it doesn't cause just one, it causes multiple, many, kind of everything. That's absolutely horrible. So I got to ask, does this affect if somebody was vaccinated and then years later, like even a couple years later, they get pregnant? Are you still seeing these adverse reactions, or is it kind of past that point?
No, I'm still seeing them.
You are? Okay.
I'm still seeing them, even in women. 4 years later, I'm still seeing them. And why do I suspect they're related? Because they're not as bad as they were, because most women know now, whether they admit it or not, the uptake of, despite these corrupt organizations still pushing it in pregnant women are smart. The American public are smart. The American public in general, I would say the vaccine uptake in pregnancy right now is less than 1%. So I think that is not as bad as I saw it in 21 and 22, in parts of 23, but it's still there. How do I know it's still there? Very easy. You do a blood test, and we through LabCorp, and you can order your own. You don't need a physician's order. In fact, physicians won't order it, but you can order your own. It's called, and you can only do it through LabCorp. It'll only cost, 40 or 50 bucks, and it is a quantitative anti-spike antibody test. And in women that have had only one vaccine 4 years ago, some of these women still have sky-high levels, documenting that the spike protein is still being produced in their bodies.
What is there anything that can be done?
Yes.
If somebody finds it. Okay. What would you recommend then?
Well, there are the most well-studied and documented therapy for this is the McCullough protocol. And the McCullough protocol looks at using a combination of 6 natural remedies. One of them is nattokinase. Another one is bromelain, dandelion root, and a couple others.
Okay.
And that has been shown to clear spike protein in men and women,
Okay.
to clear it. And it's the most well-studied and documented. There's a lot of people. And by the way, full disclosure, I'm on the board of the wellness company, twc.health, right?
Yeah.
And so Dr. Peter McCullough, Dr. Drew Pinsky, Dr. Alejandro Diaz, Dr. Kelly Victory, and also Dr. Harvey Reish, we are on the chief medical board of the wellness company. So the wellness company is broken away. They're over 3 years old now, and they have essentially, what you were talking about earlier, completely developed a parallel healthcare system. So we have doctors like me that do telemedicine.
Wow.
We have an entire formulary. You can, we're separated from the insurance because they're corrupt. We're separated from the government because they're corrupt. We're a parallel healthcare system. There's many like us, but none have been as successful as the wellness company. And so, they've done an amazing job. So the ultimate spike detox is the way to go with and using the McCullough protocol.
Okay.
And obviously other really important factors. It's interesting, Lauren, I'm getting calls from people women all over the world of reproductive age, many of them high-level influencers that were pushing the vaccine, and now they realize that they've had losses. So they're back channeling me, and I'm not going to mention any names because
Sure. Yeah.
I would consider it a violation of privacy.
Right.
But everybody would know their names. And so I'm getting consultations all the time for women of reproductive age that are having problems. And by the way, I try to see every person that calls me. And by the way, it's pro bono. I don't charge because, God has charged me with providing and helping as many of his children as possible, especially focusing on pregnant women, preborns, and newborns. So I do this for free. If somebody wants to make a contribution to one of my 501c3s, that's fine. We have a 501c3 at the Wellness Company. It's called the Wellness Company's Initiative Fund. And Foster Colson, the founder, and Mr. Peter Gillily, the CEO, I challenged them. I said, Foster and Peter, my heart is for the vaccine injured. For the rest of my life, they've been thrown under the bus. I'm committed to supporting them. I want to donate all the proceeds from my book and also large amounts of monies from Maggie and I to this wellness fund. And I want you to match every penny that I put in. And I want the initiative fund to go only to the vaccine victims. And they said, right on, Dr. Thorp, we're with you. And so a percentage of their sales, they're matching everything. You know, all of my book revenues goes to the wellness fund. And so, you know, the wellness company is an incredible organization. And all of my colleagues on the chief medical board that I mentioned share my values for medical freedom and are committed. You know, I mentioned Dr. Drew Pinsky. He's on the board too. I think I mentioned him, but just an amazing group of physicians in this company for the right reason, not to make money, to help Americans in freedom and to provide another alternative of healthcare.
Let's talk a little bit about what did the OB-GYN's financial kickback for getting vaccines in their patients? What was that like?
Yeah, I want to be upfront. I think I don't, there were probably many groups that received large amounts of money through the programs that were available to healthcare providers. But let me state this. I don't think that was the main kickback. Okay. I think that the letter that I aforementioned from September 27th was that if they didn't do that, and ACOG even gave them talking points. So you weren't talking to your obstetrician. So it was primarily a threat. And that's why there's so few of us that have come out. You know, I can count them on one hand. Dr. Dan McDyer of Jacksonville, Dr. Kimberly Biss of St. Petersburg, Florida, Dr. Christiane Northrup, who is my genre, probably one of the most famous obstetricians, gynecologists in the world in her day, you know, in the 90s, published, you know, was all over the world with her famous bestseller books. You know, there's Poppy Daniels, who's an obstetrician. There's other obstetricians I know of that I won't mention their names because they're trying to stay under the radar. Yeah. But see, there's very few, because if you didn't do it, then you would have been terminated, just like I was terminated at SSM Healthcare Systems, one of the largest Catholic healthcare systems in the United States of America. And I was their most productive maternal-fetal medicine physician, arguably, according to some of those colleagues I worked with, I was the most loved, and I had the highest patient rating scores. Yeah, sure. And I was terminated because I testified in the United States Senate, and because I was on the Tucker Carlson show, and because all of my publications, I ran up the flagpole in the SSM Health Institution. So because another publication, Maggie and I, we documented that $186 billion, Lauren, fathom this, $186 billion were given in early 2021 to over 420,000 hospitals or physician clinics in the United States of America. Let those numbers sink in. That's 186 billion over 420,000 hospital systems. So interestingly, they targeted at first the big hospitals that were faith-based. For example, Houston Methodist and Mary Talley Bowden, SSM Health and Dr. Jim Thorp. They were given money under the table to push this deadly experimental fake vaccine in their employees and in all their patients. And if they didn't, they were fired, right? So SSM Health fired me. They took 307, to be exact, $306.9 million from the HHS in early 2021. So they had to fire me two plus years ago, June 29th, 2023. They fired me.
Wow.
By the way, this exact same day is my partner on our weekly show called Two Docs. Dr. Rennie Moon was fired from Washington State, one of the academic programs up there in Washington, the communist fascist commies of Washington State.
Yeah.
So she was fired on the exact same date I was. We share that anniversary about 27 months ago, right? So this is people that speak out. You know, I've received many, many death threats,
Oh my gosh.
maligning, mocking, derision, blacklisting, firing, censorship. That's why I know I'm over the target. And that's what keeps me going is, you know, I speak the truth and I don't compromise it and I don't back down and I'm not going to be intimidated. You know, I'll die for my convictions. I don't have any fear of death or any fear of, you know, being taken out like Charlie Kirk. That's fine. But I have no problem with that. I'm going to speak the truth.
Yeah, and I think the whole Charlie Kirk thing, I mean, at first I was like, oh, this is kind of scary. And then I was like, you know, forget it. Especially, I have children in this world. I want to be around for them, but I also want their world that they grow up in to be the world that I see as good. So we have to speak out. Even if we're parents with young children, we have to speak out. Even if it's, you don't need a podcast, just in your own world, whatever God calls you to speak out, we cannot be afraid. I think it's the first or second chapter of your book, you talk about the whistleblower that was the labor and delivery nurse. And when I was kind of reading her story, the numbers were really shocking to me. So she was saying that before the vaccine rollout, there was on average 4 stillbirths in the year. And then after the rollout, she was seeing about 20 to 27, if I remember correctly, a month. If I understand that correctly,
22 per month.
22 per month was the average.
Is what the email said from the head administrator of women's health in that hospital in Fresno, California. That went to every member of labor and delivery. And there wasn't, so all she did was leak that to CHD and to me.
Yeah.
And by the way, you should know that you probably do know that, you know, she's one of my heroes and she's still employed by that healthcare system.
Yeah.
But she's a whistleblower and they retaliated against her because they refused to give her part of her pay.
Tell us the number. I love the number in the book. How much did she lose out of her bonus because she spoke out?
Yeah, and you see that I actually started a GoFundMe and got her $7,777.
That was awesome.
I had to, because the bribe and the paycheck, the bonus that her colleagues received was something like $6,666 or something like that.
Yeah, that's what I remember.
It was crazy. There's not spiritual significance to that. You got to be blind. So that's why I came back and did the 7, because in the end, Jesus Christ said, I am the way, the truth, and the light. Nobody comes to the Father except for me. So we put light on that, and it's a spiritual battle. This is a spiritual battle, and it's not most people don't recognize this. All the bribed care providers and the doctors they're not evil people. They're not indwelt with Satan. They know not what they do. But at the very top of the globalists and the leaders, they knew Borla the butcher, Bansal the butcher, the Gates, Fauci, and the higher level of the World Economic Forum, Klaus Schwab, his sicko Noel Harari. They all knew what they were doing. They were causing a population reduction which has been planned for decades, and they are indwelt with Satan. But they're indwelt with Satan. That's their, whether they realize it or not, they are indwelt with Satan.
Yeah.
Most of the other people are just ne'er-do-wells that are ignorant, like the the doctors. By the way, I used to hate attorneys, and of course I'm married to one, but I just had a disdain for attorneys.
Yeah.
I have more respect for attorneys now than I do physicians. I have zero respect for physicians. Most of them are scum of the earth. Yeah. Most of them are lying, demented, brainwashed idiots that are harming their patients and don't have the intellectual, the moral integrity to honor their physician-patient relationship. They're liars, and they just do it for their paycheck.
So let me ask you, because the biggest thing when I was hearing, especially when the labor and delivery nurse who was just experiencing it on such a personal level, these numbers, and she was like, everyone's seeing this. Even the hospital wrote out, which was so sad, how to bury the bodies or how to dispose of the bodies of these stillbirths. It was heartbreaking. But so I was wondering, I was like, how many labor and delivery nurses and OB-GYNs were they just not noticing? Were they choosing to turn a blind eye? Do you think they honestly didn't notice? I guess, do you think that every OB-GYN and even labor and delivery nurse had to have seen the relationship of the COVID vaccine to all these miscarriages and stillbirths?
Yes. And I saw the same rates, by the way, when I was up at SSM Health. There were weeks where we would have massive number of fetal deaths in 2021 and 2022, and it was just buried. Listen, I don't mean to, I'm almost embarrassed to say this, but it, to my knowledge, it is a fact. Yeah. I'm the most published, experienced OB-GYN maternal-fetal medicine specialist in the world on COVID-19 vaccine. Hands down. There's nobody that can come close to me, to my knowledge. Yeah. So I'm embarrassed to say that. I'm sorry if it comes across as being...
No, it's humility is being truthful. Yeah.
But I gave all those publications to SSM Health, and in a normal environment, it would have been taken to a division meeting. It would have been taken to a department meeting. It would have been taken to a grand rounds, and I would be allowed to publish and present all my data. No, I was silenced. My immediate supervisor, who, by the way, I trained, I fed him all of the publications. I told him what the problem was. His response, just shut up. I'm really sick of this. Let's just do our business. No. So in essence, the CEO of the healthcare system called me up. I knew it was coming. Said, hey, you are a model physician for our system. Everybody loves you. The patients love you. Your colleagues love you. But we have to enact a termination, a no-cause termination for you. And of course they did, because if they didn't terminate me, they would have had to pay that $307 million back. This is the way it works, but the light at the end of the tunnel for Michelle Gershman, Michelle Spencer, is the following. She is now suing the hospital. I think it's Cloverdale in a hospital in Fresno, California. She's suing them for retaliation for her whistleblowing, and she has deep pockets behind her, which is the deep pockets are CHD, Children's Health Defense.
Good.
And they have recruited me as one of their expert witnesses, which I've agreed to do.
Yeah.
And the other good news is, by the way, there are many other deep pockets that are coming after me to fund an exact same lawsuit at SSM Health. Because really, the retaliation against me was far worse than with Michelle Spencer. They terminated me. And then they tried to bribe me with $90,000 for an NDA, non-disclosure agreement, so I couldn't talk about it.
Yeah.
And I politely said, no, you keep your money. I have the entire transcript of that 45-minute conversation. The entire transcript. My attorney wife witnessed it, and we have it all recorded in writing. And it was an unbelievable conversation. The termination agreement, no-cause termination, allowed me to work for 120 days and receive payment and take care of patients. But yet, after the 45-minute conversation, when I didn't agree to take the bribe, 7 minutes later, a system-wide email went out firing me immediately, which was defamation too. It broke the employment contract. They locked me out of the system. And they did that when we had a critical shortage of maternal-fetal medicine doctors. So these institutions, they don't care about
all those patients at risk too.
They don't care. And I had partners calling me up, what is coming off? We can't afford to lose you. You're like the number one producer of taking care of these patients. We can't afford to lose you. You got to at least work your contract out. Sorry, I can't help you. Many employees contacted me. I was loved. That's exactly what the CEO told me. And by the way, that whole saga is posted all over my my X, formerly Twitter account. Yeah. In fact, it's my pinned tweet for over 2 years now. So this is exactly how corrupt our system is.
Yeah.
And it's awful. And I hope that this lawsuit against Cloverdale Hospital for retaliation of a whistleblower, and I look forward to considering the same action against SSM Health, because they deserve to be exposed.
I agree, especially so that's a Catholic hospital.
Yeah.
As a fellow Catholic, that makes me so upset. I mean, our job is to protect those that can't protect themselves as Catholics. So I've seen, to be honest, I feel like every time I hear that there's some corruption or something bad happening in a hospital, it seems to be a Catholic hospital. So we need to really go through and overhaul those places. This is not what we're called to do as Catholics, to just silence those people.
Maggie and I have attended a local Catholic church here in Gulf Breeze, Florida, St. Anne's. And I got to tell you that, I've never seen so many younger kids coming into the church in my lifetime. I've never seen, and that gives me so much hope.
Yeah.
I've never seen anything like it. And even adults who are coming in and getting baptized I've never seen that before in the Catholic Church.
Especially the Catholic Church.
Especially
people, they tend to gravitate towards the praise and worship and the coffee hour. And I think that people are now, they want something deeper. They want something more real. They don't want to just be entertained. And you turn to the church, like the Catholic Church, and you see there's substance there that I think is missing. I'm a convert, so I came from Protestant to Catholicism right out of high school, and praise God, my family has followed my path. But
That's beautiful.
You just encounter, you know, there's so many problems with the church, and so I get that question too a lot. It's like, well, we're the teachings are perfect, but I don't think the people in them are perfect, because that's not possible. That being said, you know,
I've been a student of the Bible most of my entire life. I mean, a real serious student of the Bible. And so I'll say this, that, you know, in Revelation, Jesus gave a direct dictated letter to John the Revelator right on the island of Patmos. And he wrote a letter in Revelation 2 and Revelation 3 to 7 churches of Asia Minor, modern day Turkey, 7 churches. And very, very, the church of Ephesus, Smyrna, Pergamum, you can go through the whole list, the 7 of them, very important to read, because those 7 churches, when you look at them, can be interpreted prophetically on many different hierarchical levels. But at the basic level, it represents a history of the church from the start of the church, which of course is Pentecost, right, to the end of the church age, when the church will be removed from the earth. So it's a chronological history of that time period, which is now about 2,000 years. And what you'll see is that in the latter part of that chronology is the church, the last church is the church that Jesus had nothing good to say about. It's a scary letter, and that's what we're living in now. We're living in the final church age of the most corrupted. So there's corruption in our church, the Catholic Church, some very serious corruption, and all other churches, every other church.
right.
That was prophesied. We're living in the church age of Laodicean. Jesus had nothing good to say about the vast majority of Christians in this time.
Yeah.
So it's not surprising that you know, we've had some failings in all of the churches, regardless of the denominations. It's pervasive.
Yeah. It is.
To be expected. What did you expect in the end times?
Not not easygoing life, right?
No, that's right.
Didn't expect it to be easy, and I think we're seeing that. I think as brutal as Charlie Kirk's death was, I saw kind of a period where people processed it, and then I was listening to some pastor saying, he's like, I would baptize maybe 10 people a year. Now he had like a line of 200 people looking to be baptized, and they all talk about, because they were inspired by Charlie Kirk, and I think something about the martyrdom of him just pushed people even more to make that next step. It's so beautiful to see how God can make something that's so horrific into something so beautiful. And I'm really excited to see where our Christian faith, our Catholic faith, is going to go forward. It's an exciting time. I think it's going to be kind of a gladiator time, but it's exciting.
Well, you're right. You're right. I mean, you're speaking right out of the Gospel of John. Remember what Jesus says. Unless a seed dies, it dies, and it falls to the earth, it will grow back in many numbers, right?
Yeah.
So it's prophetic of exactly what happened to Charlie Kirk. It's really goes back to Genesis, and what, as I believe Jesus spoke through Joseph, the 12th son of Jacob,
Yeah.
when his brothers all tried to murder him and, sold him out, and they finally met up with him, 28 years or so later, when his brothers were begging him. He was the number 2 in charge of the
Right.
Pharaoh, right? So
Right.
God took him 22 years after his brothers tried to kill him. And what I believe Jesus spoke through Joseph, he told his brothers, what you meant for evil, God used for good, because he saved the entire Jewish nation.
Right.
And we see again in Romans 8:28, all things work out for the good of those who put their faith in Jesus Christ, in the Lord, in God.
Yeah.
All things, not some things. So yes, Charlie Kirk's assassination at age 31 was awful, but Satan meant it for bad. God will flip it around and use it for good, exactly as you just said.
Yeah.
And I'm hoping the same parallel is for this disastrous decision for Trump to embrace the CEO of Pfizer, Bourla, and sign off on a $70 billion deal to expand mRNA technology.
Let's talk about that. That's what I feel like is slipping under the radar a little bit right now. So what exactly is this deal?
It's awful. I feel betrayed. It's awful. It's, listen, love me or hate me, I think a lot of Trump. I voted for him 3 times. He was runner-up, in my opinion, for one of the greatest presidents in the history of the United States of America. And that's all fading. Right now,
We're all feeling that way.
he's about on the level of the Antichrist to me right now. And I hate to say that. Is he the Antichrist? No, he's not. He can't be. I won't go into that. But he's certainly a prototype of the Antichrist. I've made peace. I've brought prosperity. I've stopped 7 wars. He's got the ego that the Antichrist is described as in Daniel and in Revelation and many other books of the Bible. So, but for him to get up there and have Bourla the butcher on the stage and sign a $70 billion deal to support that is just an abomination. The week before, he also, and I was really pretty offended by, all the doctors standing behind him. He made this proclamation of, Tylenol and pregnancy and this stuff.
Yeah.
And not one of the doctors or Bobby Kennedy behind him mentioned the death and destruction from the vaccines. They were all, and I felt like they were, exponentially exaggerating the risk of Tylenol in pregnancy at the expense of hiding the massive damage from the vaccines in pregnancy and in children.
It kind of became a joke, and then I saw women taking Tylenol in excess for no reason because they're pregnant and they wanted to retaliate, which is a different just disaster. But it became the focus of this whole thing is like, oh, Tylenol causes autism. Everyone's kind of joking about it. And it's like, that's not really what it is. It's the relationship to the vaccine. But of course, that's all people heard. And we don't have many people even talking about the vaccine causing the problem.
That's what I termed it is, I think you'll love this, Lauren, is it was a planned PSYOP smokescreen to hide the vaccine damage, death, and destruction. It was a look over here to my left hand while my right hand is doing something bad. It was a classic Tylenol smokescreen. And so, but it was all old news. These studies on Tylenol, we've looked at it for 25 years, maybe not quite 25, 22 years. And some of the studies say, yeah, there is a correlation. Others say no. I think the best study was the study from Sweden that actually didn't use old data and ask patients to remember whether they used Tylenol. But this was real-time data from many years ago that they held from medical records, and they've been following for many years. And that study, when it took into account many of the potentially confounding variables, one of the most important variables that it accounted for was siblings. Did the siblings have autism or autism spectrum disorder or ADHD? Very important, because that serves as a moniker, a surrogate for genetics and for environmental conditions. And when they took the siblings' data into account, there was no effect.
Wow.
Now, what do I believe? I think, first of all, it was an abomination that there wasn't a very experienced OB-GYN maternal-fetal medicine physician up there on that platform. That was an abomination, with Trump making all these global statements about pregnancy. Not one of those doctors up there have any OB experience. What are they making proclamations for about pregnancy without somebody experienced, a physician experienced in obstetrics? Why weren't they up there, number one? And number two is I do believe that there is a potential plausible mechanism and for using but it starts with vaccine damage or a viral infection damage in the fetus, in the mother. When there is an insult to the fetus and there is a liberation of inflammatory mediators in the fetus, the preborn or the mother, and mom takes a Tylenol, that will probably potentiate the disaster. Why? Acetaminophen or Tylenol is dangerous in that it reduces a natural anti-detoxification molecule, which is called glutathione. Glutathione is only 3 amino acids, and it is a potent detoxifier. And so Tylenol inhibits that. So if you inhibit glutathione and there's damage on the baby's brain, an infection, inflammation, the Tylenol is going to make that much worse. Same in children. So it's not really the Tylenol that's causing the brain damage or in the preborn or the newborn or the child. It's really the vaccine, and then the baby having severe, or mom or the child having severe vaccine effect, and then giving Tylenol on top of that.
Yeah, it's the added hit.
That's right.
Puts it over the edge.
That's right. Exactly.
Yeah, I'm glad that's kind of how I understood it. So I'm glad you clarified that, because I think a lot of people are very confused, and they're, like we talked about, they're just hyper focused on the Tylenol. When, I mean, I probably wouldn't recommend Tylenol, right, during pregnancy, but when it's really deadly when you combine it with the vaccinations.
Right. It's like, listen, you don't eat unpasteurized yogurt. You don't eat certain fish. You don't eat certain foods. You never drink alcohol in pregnancy, and you never take any medication if you can help it.
Yeah.
There's a lot of confusion up there, and among other self-proclaimed experts, fever causes brain damage. No, that's really not true. What is true is that not fever or hyperthermia, too high of a temperature in mom's body or the fetus's body, the embryo's body, between 3 and 5 weeks after conception. That would be 5 to 8 weeks after the last normal menstrual period. If you have an elevated body temperature during that time, whether it's caused by you getting into a hot tub and staying in a hot tub, or whether it's caused by, severe fever, that elevated temperature will increase the risk of spina bifida, heart defects, and cleft lip and cleft palate. And that's been shown in pretty good data. I'm pretty comfortable stating that.
Yeah.
So but later in pregnancy, it doesn't have the same effect, the fever or the hot tub. It's not.
Oh, that's good to know. Because at the end of my pregnancies, I was like cheating and taking hot baths because I was so sore. I was like, so that's good to know. Later in pregnancy, it's not as dangerous, if I understood you right.
That's exactly right. It poses very little, if any, threat. Obviously, you don't want to stay in a hot tub for,
Yeah.
too long, and there's nothing wrong with a
I feel
nice.
like there's just so much chlorine in there. I don't really like them anyway. I'm just
That's right.
just sitting in a chlorine bath and it's just in my face. So.
But a nice hot bath with, Epsom salts or natural oils to ease your aches and pains, after 12 weeks of pregnancy is not a problem at all.
Oh, that's good to know. That's good to know. Any future pregnancies, I won't feel as guilty. Well, that's good. Let me just ask you one more question. What is it like, especially with going into this with your faith, to tell me about how it was to tell these women, you're looking at their charts, you're seeing there's no more heartbeat. What was it like to tell these parents that their child is no longer with them, knowing that it was something so easily prevented?
It was really, really painful. And it was so painful, Lauren. It's one of the most painful parts of my job. It happened too many times. In our book, we write, I believe it's chapter 7, it's called 8 Candles. A patient that is in her family that's been very near and dear to my heart, young, beautiful couple, had a perfectly normal baby in 2019 before the shots. Took a shot. They've lost 8 babies. 8 babies. You say, well, Dr. Thorp, how could you lose 8 babies? Well, there were 2 sets of twins, and the others were late miscarriages or stillbirths. And the last one, the 8th one, was near term when they were planning a cesarean delivery. I think a week or so was coming. She experienced a massive placental separation, massive blood loss. It's called a complete abruption, is the medical term. Raced to the hospital, did an emergency cesarean section, delivered a dead baby.
Jeez.
Another dead baby. And she almost lost her life from a catastrophic hemorrhage. And the damage you'll read in that chapter, is that unfortunately, due to a variety of psychological and psychiatric mechanisms, the patient can't come to grips with the fact and connect the dots. And I find it so sad. And most pregnant women that have had these catastrophic losses can't let themselves admit it, that they were fed a lie and that they allowed something to be put in their body that killed or injured their baby. They can't do it. It's too painful. And it causes massive relational loss in a family unit.
Sure. Wow. So is that where you would say, man, that's 8 babies. I couldn't imagine going through labor and holding the baby dead after that.
God made this to be the most sacred time in a couple's life. Is God's creation of a new life by the love between a husband and a wife. There's nothing more sacred than that. And to have that preborn killed by a vaccine is devastating. It's just devastating.
So it's evil. And that's where I think about where Bill Gates made that TED talk. Where he's like, talking about overpopulation, and we just change healthcare and improve vaccinations, we can lower population by 10 to 15%.
That's right.
And I just think, I'm like, man, when I read your book, though, it has to be more than 10 to 15%. I mean, what would be, I don't know if there's data on this, or maybe you can just give me an idea based on your experience. The women that have had COVID vaccines, what do you think the percentage of those women is that are experiencing fertility or once they're pregnant, these issues? What would you guess the percentage is of your average vaccinated woman?
There aren't good data because the government won't let us study that and won't fund that data. I can only speculate, but it's a large, significant proportion. I should mention, this is important, really important work. If you go to ethicalskeptic.com, the ethical skeptic, he's an anon, but I've communicated with him and he's spot on. And what you'll see is that he writes a lot of really erudite, very excellent data. And he wrote an article, and you can look it up in his archives, that looked at, this is the governmental data which was finally released, the Medicaid data nationwide. And this is straight from the government's database. And what he found, this is really scary, was that the trend of the child mortality rate has come down, long-standing for like 30 years. But at 2021, there was an inflection point after the vaccines. And what the government data showed was that, just released this year, was that children age, newborns, 0 days of life to 4 years of birth, the death rate skyrocketed with an inflection point like this. And it's hidden. It's governmental data. I've had this data, but it was not legally obtained. It was from a whistleblower 2 years ago. So I've looked at it and saw the massive increase in fetal deaths and everything. My attorneys and my wife wouldn't let me publish it because it was not legally obtained. It was obtained from a whistleblower, right? So I knew what was going on, but now this is legal data, but it's all being hidden. None of the doctors have talked about it. None of the mainstream media. They're all bought off. They're all bought off by big pharma. But this is the government's own data. Go to the ethicalskeptic.com and look at it in his archives. It's from probably 6 weeks ago.
Wow.
Very, very important study. But there's nothing here or there, right? They're all ignoring it.
I think it's so interesting. I've been noticing there's this trend that's been, if you look at the way our culture is, and now we see the medical aspect, there's this trend of making it where women and families can't have children. We look at the social trend. It's like everybody, is now starting to have kids. First of all, most people are now getting married at 30, 35, when fertility, even if you're healthy, is already starting to drop. And then, then you combine the fact that this woman has been on birth control probably since she's 16 years old, doesn't even know what a period looks like. She gets off of it, and let's hope she's not vaccinated. It's like, well, her body has to already repair, and she's getting older. And then, so it's like, so she's been on birth control. She's older. This is the cultural norm now. It's have kids as old as you can, pretty much, because you want to enjoy your young years as much as you can. And then, be as sexually promiscuous as you want because you're going to be on birth control, so it doesn't matter. And we don't realize is that what we're doing is we're selling a generation of women birth control. And it's now seen as like a vitamin almost. It's like, I remember, praise God, I never was on it, but I remember being told, from my doctor, it balances your period. It's not at all what it does. And then we've messed up women's cycles, and now they're 30, 35, thinking they're going to just get pregnant, and it's not the case. And then you take in this new factor of now most people are vaccinated. It's like, my gosh, how much of a population hit are we about to see? Because I don't think everyone's walking around still. We're overpopulated. I'm like, we're not overpopulated. And especially give it 20 years, you'll start to see that there's fewer and fewer kids going to school because they're not being created. And I know I learned in school and college that to even maintain the population level, at least what I was told, you have to have a birth rate of your average couple needs to be average at 2.4%. Well, we can look around. The cultural norm for years, probably since the 70s or 80s or 40s, I don't even know. But the norm has been for every couple to have 2 children. Well, that alone tells you if everybody goes off and gets married and only has 2 children, we're already declining our birth rate. So now you take in the fact that people are getting married older, birth control, all these health issues. It's like, what kind of population crisis are we about to wake up to? I think we're kind of doing catastrophic damage, in my opinion.
Lauren so eloquently stated all of the potential, the real confounding variables and contributors of this. And there's so many more than what you mentioned.
Yeah.
One of the things that I think we need to mention, extremely important, is the integrity, the perceived integrity of life and abortion.
Right.
Abortion is and it's the liberal progressives that have pushed this as applauding it, killing God's child in the womb, the most vulnerable, is an abomination to God, and now it's the right thing to do because it's women's health care. No, that's not women's health care, killing preborns. I'm sorry, no. There's this commandment, one of the 10 commandments, it's called thou shalt not kill.
Yeah.
Right? And also, not to get overly spiritual on you, but
no, please
and on your audience, but remember in Genesis, when Cain killed Abel,
mm-hmm.
and God or Jesus or the Holy Spirit, they're all the same, the Trinity, came to Cain and said, basically, you've killed your brother and his blood is crying out from the ground.
Mm-hmm.
Think about that.
Yeah.
We Americans are celebrating the murder and killing of 1 million babies per year. Think about how loud that, we've killed, 60 million babies since Roe versus Wade in 1973 or more, maybe 70 million. 70 million babies we've murdered and killed, and their blood is contaminating the soil of the United States of America. And worse yet, we, as the American people and the government, has exported this ideology and pushed abortion and vaccines to the whole world.
Human sacrifice. We're human. This is.
We
look at the Aztecs and we judge them, and it's like, look at what we're doing.
Yeah.
It's horrendous. I can't even imagine, too, you as an OB-GYN seeing the babies. It's like, I think I always knew abortion was wrong, but once being pregnant and also watching those ultrasounds, it made such a more personal connection for me. And I remember my daughter, my second born, she was born, I have to look at the dates, but I know she was born not long before, let me think. She was born and a week prior, Roe v. Wade was overturned. And there was that whole thing with, people getting upset with that. I just remember looking at her and thinking, my gosh, if I wanted to no longer have her in my womb, somebody would just legally in my state rip her out of me and kill her. And that infuriated me. I'm just like, this is so evil. And I don't even know like what people are doing. And it's just that I think it's that lack of connection, you know, because, but then, you know, I listened to a doctor who was an abortionist, and he had a conversion. And so he now was at this point in the video speaking out. And somebody asked him, you know, when you were doing abortions, did you believe that was a baby? And he said, yes, I just didn't care. Like, my gosh, like the how evil. I mean, luckily he's had a change and he's now being brave enough to come out with the wrongs. But my gosh, so that just kind of puts my mind of like all these abortionists, what are they doing? Like they can't not know that's a baby.
Yeah, I know the physician you're talking about, and I want to plug another physician, a very dear friend of mine. His name is Dr. Bill Lyle, Lile, and go to prolife.com. Dr. Bill Lyle, he's he's a incredible physician, probably one of the greatest advocates for pro-life in the world. He's been all over the country speaking on this. He and his wife Leslie are dear friends of me and my wife Maggie, and he does a tremendous job. He's got some incredible clips on the website, and he and I are very tight. Pro-life doc, PROLIFE doc.com.
Okay.
Dr. Bill Lyle, give him a shout out.
Yeah, I know.
Yeah, and you know, you should have him on your
I
podcast.
think I'm going to reach out to him. Yeah.
I'll give you his number
Thanks.
after we stop the recording, and you let him know that I gave you his number and you need to be on his podcast. But you know, it was back in 2003, Lauren. I had probably been one of the physicians that had done more closed fetal surgeries than most all other physicians in the country. By that I mean doing procedures using a needle or a catheter and an ultrasound without opening up the uterus. So I was asked to testify in the United States Senate, then under the Bush administration, and my testimony was treating the fetus as a patient. And the whole goal of the testimony was to take down the partial birth abortion, which I don't know if you're familiar with partial birth abortion.
I am, yeah. But for those that are listening, tell us a little bit about what it is.
It's hideous. It's you basically kill a baby in the womb up to term. You basically penetrate their brain and suck out their brains and and then piecemeal pull out the baby piece by piece. It's grotesque.
And it's when you say partial, it's because they actually the woman gives birth partially. It's just the head doesn't come out. Is that right?
Correct.
How evil! You're like this doctor's holding this baby that is moving, and because it hasn't fully exited.
Well, that's right. It's horrible. It's a horrible satanic procedure. But you know, this is what the evil progressives celebrate. Remember that, Lauren, a few years back, when the New York State actually gave the doctors the discretion to kill a baby after birth in the delivery room for a failed abortion, or if the mom and dad didn't want it. And what did they do? They celebrated it. They lit up the bridge to celebrate this. This is how evil our country is now. And we're going to be judged. Remember, this nation will be judged for sacrificing 60 or 70 million of God's most vulnerable children on the altar of Satan, Baal, whatever cult, whatever ancient civilizations that satanic entity manifest as, Satan or Baal. This is what we've done. This is modern day burning your children alive. Kind of like what happened October 7th, 2 years ago,
Yeah.
right, in Israel, burning children alive. And this is what Satan does. He comes to kill, steal, and destroy. And by the way, this whole thing about, destroying and attacking the patient family with this whole issue of taking mom's rights away. Oh, you don't have your rights. You have to go to a public school. They have to be indoctrinated and have drag queen shows. They have to be told what gender they want to be. This is from Satan. And so many men, for whatever reason, born biological males go trans now because that's the thing to do. And this is a targeted assault on the basic unit of humanity that God planned in Genesis. Yeah. The whole enchilada, everything.
Yeah.
And it's awful.
Yeah, I studied at, I don't know if you're familiar with John Paul II's teaching on theology of the body, but you're speaking right to it. It's, that was kind of my focus when I was in college, and then I interned at their institute. And it's God, man and woman, he created them. And we're just blaspheming that with everything we do in our society. And I know we've talked earlier, I homeschool my children. And partially is because we're in Connecticut, and I can't even send them to a Catholic school unless I fully vaccinate them, which is like a whole thing. So evil. So it's like but then I'm like, well, even if I could send them, would I want to? I mean, look at what's going on. I have parents that I know that send their kids to public school, and they're constantly worried their kid's going to be shot at school. And it's like, and then it's like there's the indoctrination factor, and you have litter boxes in kids' schools for the kids that identify as cats. It's like, it's just absolutely like, we have to keep our kids closer. I'm a very, I'm watching Little House on the Prairie, and Laura Ingalls is just out hanging out with strangers. And I'm like, man, I wish my kids could grow up in that life, but we're not in that life today. We're in a different culture, and we need to keep our kids close. Otherwise, if we don't educate them, they're going to get indoctrinated.
You're so wise, homeschooling and
Thanks.
Not vaccinating. I'm so impressed with you. And
Thank you.
If there's anything that I can do to ever assist your ministry,
thank you. I appreciate it. You're so generous with your time.
It's an incredible job that you're doing. And repeat again where you did your undergraduate and
Franciscan University of Steubenville.
University of what?
Franciscan University of Steubenville. So
where's that?
It's in Ohio.
Steubenville, Ohio.
Yeah, exactly. So it's one of the more popular, if you're really looking for an actual Catholic school. It's one of the few that are kind of left. Ave Maria in Florida, you're down near that one. That's the other one. And then there's the Catholic University of America in DC. And then there's one other. There's a few others, but it's pretty much one of the few in the United States that I'd say is like actually Catholic. And Scott Hahn teaches there. I got to learn under him, and a couple, Dr. Bergsma, Pints with Aquinas. I'm going to name drop a bunch of people. They're all in Steubenville. So it's very blessed with this culture of rich Catholicism, and so that's where I did my undergrad. And I'm very fortunate to have gone there. So yeah.
That's beautiful. I wasn't aware of that. I spent some time growing up around the greater Cleveland area and actually attended St. Edward High School, an all-boys Catholic high school by the Brothers of the Holy Cross there. And Steubenville I'm very familiar with. We used to do some athletic competitions down there. And also there is St. Ignatius of Loyola by another high school by the Jesuits. So, yeah.
Yeah, that's great. I mean, it's such a small world once you're Catholic. I gotta tell people, somehow I end up knowing everybody because and hopefully that we keep expanding. It sounds like a lot of people are going back to church. So, but I just have to say, thank you so much for being so generous with your time. I think that there's so many people that are struggling with fertility right now and struggling with miscarriages, and they go to their doctor and they're just feeling gaslighted. Like they're not being told what the problem is, given kind of silly answers like you need to gain more weight. So yeah, I just can't thank you enough. I think a lot of people are going to benefit from what you have to say today.
I'm so proud of you, Lauren, and you give me so much hope for the younger generation. God bless you. God bless your husband, your children. May Jesus put his arms around your family and cover you with a hedge of protection and advance your ministry to the whole world. Thank you so much for having me on.
Thank you. I appreciate it. And I hope you have a great rest of your day. All right, I'm going to end the recording.